This week we're looking at what to expect after we break our ankle and require internal hardware to correct it. But first, our disclaimer. Mike Matthews, physical therapist here with the PT 411. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, Instagram, TikTok, and Twitter. Also, make sure you check out thept411.com. So it's time for another WTE video, or what to expect. Oftentimes we get so hung up on current pain and injuries and the surgeries that are needed to correct them that we miss out and we aren't educated on what happens after the surgery. And who better to explain that than a type of person that you're going to be spending most of the time with after surgery, a physical therapist like me. This week, we're looking at what to expect after the internal hardware is placed after an ankle fracture. This procedure is called an ORIF, or open reduction internal fixation. The fracture can happen from many different things, from car accidents, athletic accidents, even just rolling our ankle just right or wrong rather. Now with the ankle, there are so many moving parts, bones, individual joints, ligaments, and tendons that when everything is healthy, the ankle and the foot work very, very well in sync together. When something goes wrong, it can all fall apart pretty quickly. Typically with an ankle fracture needing this type of surgery, it's on one or both of the malleoli, that's the lower part of the tibia and fibula. With all the moving parts, it becomes more difficult for the positioning of the bones to maintain for a correct healing to occur afterwards. So that's when rods, plates, and screws are needed to hold everything into place to ensure that proper healing. Now, I'm not going to go into detail of the surgery itself. That's not what this video is about. We're going to go and look at what to expect following the surgery. But the first thing I have to say is this may not be 100% accurate to each individual plan of care. Not all surgeons will do the exact same thing, and between them and the care team that they refer out to, there will be some variations in protocols, and this video is based on the most common themes that you will see after surgery. So just keep that in mind that no two people will heal the same. Recovery times may be a little different, and some surgeons may have to call audibles throughout the recovery process. And also people will have different goals and lifestyles to get back to. Some people may be jumping off the recovery train much sooner. Someone who goes on a stationary bike mainly for exercise and works primarily a desk job will definitely have a shorter recovery than an athlete that's going to have to go back to more high-level activities. So we just had the surgery. We're waking up from sedation. Early on in the process, it's all about pain control. Take the medications per your surgeon's instructions. We need to make sure that your pain is held at bay enough to allow you to get the rest that you need to maximize the early healing process. Instructions will also include some sort of form of elevation and icing, that sort of thing. Now the ankle itself needs to be immobilized. I've seen people placed in various things. This includes casting, boots, removable splints, and so on. I would say on average, you're not going to be putting weight through it through 6 weeks, no standing or walking on it for about a month and a half. At usually about week 4, therapy will start. Therapy early on is going to just include range of motion and gentle stretching exercises. It doesn't take long for a mobilized body part to tighten up, and it's going to do so even more after surgery. We had surgery, things are immobilized, tissues are healing, things are mending together, and without movement, things will heal up very, very tight. Around week 4, sometimes we may even get to start doing some gentle isometric strengthening, basically where we're pushing to toleration against an object to get some early work out of our muscles. Now we get around to week 6, we can start practicing weight bearing. We transfer our weight onto that foot while it's still in the boot from various positions. We start walking on the boot just a little bit as well. By the time the surgeon releases us from the boot, hopefully we've gained enough motion back that stiffness doesn't limit our mobility that much. Now, whatever motion limits remain, we get much more aggressive at this point. We also start to get on a stationary bike or an elliptical. At about weeks 8 to 10, we can start working active strengthening using a resistance band and our body weight. We can also start to work on simple balancing activities. Now, over the next few weeks, we're just going to keep progressing these activities as the body can tolerate. Once we get to about weeks 12 to 14, we can start jogging. For our athletes, around weeks 14 to 16, we can start start doing plyometrics, our more jumping, ballistic type activities, more staying into place. At about week 16, we can start working on more advanced stuff like sprinting and cutting and jumping forward and backwards. Now it's around weeks 20 to 22 that we want to start getting people fully back into athletics, that sports participation, if it's applicable. Now during the recovery, therapy will start off at about 2 to 3 times a week. And depending on the individual, how well they're doing, we may adjust this up or down a little bit. As time goes on, therapy will work with specific goals with the individual, and therapy will taper off at some point in time as we transition the person back into their own activities. Now, during this time, you're also going to have follow-ups appointments with your surgeon. Usually this will happen around week 2, then around week 6, and at 3, 4, and 6 months. Now, sometimes this timeline will vary, and depending on the surgeon, they'll do repeat x-rays at some point in time to ensure proper healing at certain follow-ups, well, both in terms of time and alignment with the bones. Now just keep in mind that some people heal quickly and some people don't heal quite as fast. Both your PT and your surgeon are there to call audibles when needed. And we're here to also tailor your care to both your current status and your goals. Just hang in there and work hard after surgery. Make sure you see therapy through to the end. You have the controls to your recovery. Again, I'm Dr. Mike Matthews with the PT 411. Thanks for joining me.